Kabaiso Olive is a happy mother after spending no money at all in delivering her fifth child at Kaihura Health Center 3 in Chenjojo district. Kabaiso benefited from the Save Mothers Giving Life project, through which she acquired a special voucher giving her access to free antenatal and neonatal care at the private health center. She bought her voucher at 6 months of pregnancy.
Dr. Yejamuka yansoborora ubyasange nyinenda yansoborora omugaso gwa voucher yagana kadi ngere ukadi boro naka akalesire gantusasura akadi akusinge 13.
The Save Mothers Giving Life project was launched almost 2 years ago and is implemented in the 4 districts of Chenjojo, Kibale, Kamwenge and Kabarore. This was after statistics showed that the districts also had one of the highest fertility rates at 7.1, higher than the national average of 6.2. In the voucher system, village health team members buy a special voucher at 2,000 shillings, which they sell out to pregnant mothers in their localities.
Now these community-based distributors buy the vouchers from Maristops for 2,000 and sell them to the client for 3,000. So there's an economic incentive there for the community-based distributors.
Florence Joyce Katuramu is a VHT member from Chenjojo district. She bought 50 vouchers in March 2012 and sold off her stock in 6 months only.
And if we don't manage the mother to deliver from here, if they get complications, we can transfer them to other hospitals which can manage deliverance.
The 2-year project, largely funded by the United States Agency for International Development and the other partners, has managed to double the number of mothers giving birth in health facilities from 32% on its onset to the current 65%. Fathers have, however, not yet taken part in this implementation.
Our men are not well involved, so we have some low male involvement. So we feel that male involvement is an area where we need to emphasize.
Each voucher is budgeted for 300,000 shillings. In this, mothers who deliver safely help offset the costs incurred by those who undergo cesarean section. Complications at the lower health facilities are solved by the presence of a 24-hour ambulance that transports casualties to bigger health facilities. As a result, many health centers have not recorded any maternal death since the project started.
Basically here, mothers, many of them are poor. So when somebody gets a voucher of 3,000 and actually is given a full package on that, we are increasingly seeing even these PNFPs like this unit here, the number of deliveries have been increasing over time.
In the period January to March 2013, this project registered 1,467 mothers who attended antenatal care with a voucher. In the same period, 1,511 safe deliveries were conducted by private accredited health facilities.
The voucher system came up with a poverty grading tool which ensures that only the most vulnerable benefit from the project. Members of Parliament from the Parliamentary Committee on Health and the Committee on HIV/AIDS and related matters have toured the project area and have called for government's adaptation of the tool so that the project can be replicated nationally.
We are going to, as a committee of Parliament, to study and how best do we improve and how do we get some of these lessons so that it can be extended or extrapolated to the whole country.
The project, due to end in April, was extended for 2 more months to compensate for the delays caused by the Ebola outbreak last year in Kibale district. According to Kitaka Florence, the Maristops Regional Program Manager, Southwestern Uganda, donors have agreed to commit funds to the project for an extra 15 months starting July. They, however, want government to own the model.
If government can get some funding to replicate this project to all the districts in the country, then the maternal mortality rate for this country will go down.
Uganda's maternal mortality rates currently stand at 438 per every 100,000 live births. However, interventions like the Save Mothers Giving Life project have proved that incentives to pregnant mothers can go a long way in ensuring they give birth in health facilities and therefore reduce on the high numbers that die while giving birth. Tiabasatumba Abubakar, NBS Television.